Hi, my name is Jamie Atkins, and I'd like to talk about differential diagnosis between bipolar 1 and 2 disorders. The layman's perception of bipolar 1 versus bipolar 2 may be that bipolar 1 is more severe and that bipolar 2 is a less severe version of the same. But the fact is that these are distinct subtypes of the bipolar disorder and that they do have relatively few criteria that distinguish them, but these are important distinctions. And they have to be looked at very closely to differentiate accurately between these disorders. So a summary table here shows the different symptoms that are considered when differentiating between these two disorders. A manic episode is required for a diagnosis of bipolar 1. It is not part of the bipolar 2 diagnosis. So a manic episode will exclude the diagnosis of bipolar 2. A hypomanic episode may occur during bipolar 1. It may precede or follow the manic episodes or depressive episodes if those occur. In bipolar 2, there must be at least one hypomanic episode that occurs. Psychosis is a feature that is distinct in a manic episode. A hypomanic episode cannot include psychosis. So by definition, the diagnosis of bipolar 2 cannot include psychosis during the elevated episode, the hypomanic episode. It may occur during the bipolar 1 manic episode, but it does not have to. A past major depressive episode is common in bipolar 1, but is not required for the diagnosis. Bipolar 2 must have at least one major depressive episode in the past. And in terms of diagnostic criteria, bipolar 2 requires that the cycling between the depressive and the hypomanic episodes causes significant distress or impairment in functioning. It's implied and quite likely that a bipolar 1 diagnosis, the patient will also experience a significant level of impairment, but it's not required in the diagnostic criteria. So to look a little more closely at some of these pieces, particularly the manic versus the hypomanic episode, I have wanted to include the criteria here, just a finer grained look at that. So the duration of a hypomanic episode is 4 or more days, and a manic episode will be 7 or more days. And the severity and effects of these episodes will differ. So in the diagnostic criteria, B1 through B7 are shared by both hypomania and mania, but the remaining criteria are distinct. So in hypomania, there's that shortened duration, and there's an observable change. So people may notice that there's something going on, but in mania, it's more likely that this is a marked impairment that might even require hospitalization. So it's observed, it's obvious, it's very clear to others that a manic episode is occurring for that patient. The presence of psychotic features does require that that episode be described as a mania, regardless of the severity or duration of that episode. And just a note on psychotic features, I was surprised to see that there is a bipolar 2 diagnosis that you can add the description that it includes, you can add the description that it includes psychotic features. I wasn't understanding why that was possible, but with further research, I learned that a psychosis can occur during bipolar 2. It just cannot occur during a hypomanic episode. So it may occur during the depressive episodes. And that was something that helped me to understand better that psychosis isn't necessarily distinct to bipolar 1, but it is distinct to a manic episode. Additional research showed me a little bit about just that initial investigation phase, some characteristics that might be helpful for a clinician. Cognitive impairment is present in both the bipolar 1 and bipolar 2 groups versus controls, but it's more often present in the bipolar 1 group. So cognitive impairment may include difficulty with verbal memory, attention, executive functioning, and the frequency and duration of episodes may differ somewhat between these groups. So the bipolar 2 group may have more frequent cycling among their episodes, while seemingly paradoxically, the bipolar 2 depressive episodes tend to last longer. So there may be more frequent cycling, but also depressive episodes may last longer, causing significant distress. Thank you.